Today I'm doing something different. I'm doing subscriber questions because for whatever reason this week I got a lot of questions on like older videos or videos that I put out a couple weeks ago, last month or whatever. So thank you guys for engaging in those videos. So that lets me know I'm posting content that is important to you. So thank you guys for the questions. I welcome the questions. Bring more questions. I love engaging with the people who land here on my YouTube channel. So if y'all want to know what kind of questions I got, and maybe these are questions you had, keep watching. I do have notes, so I will be looking at these questions because I didn't memorize them and I'm going to be answering them kind of right off the dome. So let's go. I did not even introduce myself for any new people who might be watching this video. My name is Chandra, aka Nurse Channie. I am a labor and delivery / postpartum travel nurse. I've been a nurse for 12 years. I have only ever worked in women's and infants. Never done any other specialty, no med surg experience outside of what I get in the postpartum world. I'm also a nurse educator and I'm a nurse mentor and nursepreneur. I have a coaching and mentorship business and a platform called the Know It All Nurse. You can find me on Instagram right here. Is where you can follow along with my journey as a nurse mentor. I give out nuggets and tips and all those good things along the way. So let's get into these questions. Oh, and just some random facts about me. I love animal print. Does anybody else love animal print? Like cheetah, leopard, whatever this is here. I love it. Stay wild. So here are some questions, again, that were on some past videos that I produced here on this channel. So let's get right into it, okay? The first question, and again, I'm going to be answering these off the dome. I haven't prepared any answers. I just jotted the questions down. So you guys are going to get like my authentic answers to these questions. So first question, can an RN with an ADN work as a postpartum nurse, or is a BSN required? So an ADN is an associate's degree. A BSN is a bachelor's of science in nursing. So there obviously is a difference in both of those programs of schools. The associate's degree is normally like a 2-year program, and it does not, from what I remember, it does not include the like the community nursing aspect of the educational program, and it doesn't include the leadership component. But it has, from what I think, and if anyone who is an educator is watching, correct me if I'm wrong, I believe that the associate's degree program has everything else that a BSN program has. Because I have taught at both. I've taught for associate's programs and bachelor's, but it's been some time. You get the same education minus those two things. And the associate's degree programs are typically a lot more accelerated. Like it's a faster pace because you're learning a lot of content in a shorter amount of time. So to answer the question, now that I've clarified what an ADN versus a BSN is, yes, you can. Because once you complete your program, whether or not you get an associate's degree or a bachelor's degree, you are still able to sit for the national licensure exam to become a registered nurse. And once you're a registered nurse, you can work wherever you desire to work. there is a small caveat to that. Now, sometimes, depending on where you work, the region where you are, the hospital that you're working in, sometimes there are magnet facilities that don't hire associate degree nurses. So that would be the only exclusion that I can think about that would not allow you to work as a postpartum nurse in a facility. But once you are complete your schooling and you are a registered nurse, you absolutely can work in whatever specialty area that you desire to work in. That was a really good question. Thank you. The next question came from a postpartum video that I posted, and the question was, do you prefer labor and delivery over postpartum? What are the pros and cons? So this may be another loaded answer. So right now, present day, no. I don't prefer one over the other. Like, I feel like I'm glad that I have the experience and the skill set to be able to work on both units, because all nurses who work in the maternal child areas they aren't able to cross train or cross work in both of those units. And so as far as a preference for me, I don't have a preference. I think that earlier in my career, when I was a newer nurse, I loved labor and delivery. And I still love labor and delivery because there's something magical about being there when new life comes into the world. Like, it's just like, I love cheering my patients on when we're right at the point where the baby is getting ready to be born. And I'm like, you can do it. You can do it. I love bonding with my patients when they initially come into labor and delivery and they have that fear of the unknown and everything that's going to go on during this process. So yeah, I still love labor and delivery. However, I feel like I'm at a point in my career where I don't know that I want to work that hard. And when I say that, I mean that between labor and delivery and postpartum, laboring with patients is the more intense part of being a nurse in the maternal child areas, because laboring with a patient is hard. You're dealing with patients who are fearful of a lot of things, especially if it's their first baby. It's the fear of the unknown because they don't know what to expect. So you have to do a lot of educating, and your patient really has to trust you as a nurse, to trust that you're going to guide them through this process with no judgment and just being compassionate and kind as possible. So it's a lot. You're dealing with the family there pre-COVID, when we could have lots of support people in the delivery. So it's just a lot that you have to deal with. Pain is a big thing. Comfort measures, like, women go from sweet as pie to don't touch me like that during labor. So it's a lot that goes into it. But I do love it. I love, like I said, being there to support my patients as they're bringing new life into this world. But it's mentally taxing. It can be draining, especially if it's a hard labor. Working at night, which I do right now, is typically more challenging because your patient is connected to a monitor. They change their positions a lot. And so you are in and out of the patient's room adjusting that monitor. And I know I always feel bad, like, I want to let you get some rest, but if the baby falls off the fetal heart tracing, I got to come back in and bother you to readjust. So it's just a lot of things that go into being a labor nurse. I think right now I'm at the point where postpartumly is less stressful for me. Like, I'm at this point in my career where I want to have as less stress at work as possible. So being a postpartum nurse can be less stressful most of the time, which the exception is my current contract that I'm on, which I'm going to talk about that in a whole other video. But for the most part, the postpartum side of nursing is, the parents can still be stressed. So you're still dealing with that fear of the unknown, especially again, if it's the first time mom and dad. However, it's just a different level of care. That's what I'll say. It's a different level of care, and you are doing a lot of teaching and educating your patients in the postpartum period. And that's what I love about the postpartum lane, because I'm a natural educator. And so for me to teach my patients how to do things like swaddle their baby, oh my God, that's like one of the first questions parents ask. Are you going to show us how to swaddle the baby? They love that. So me being able to show you how to swaddle your baby, like, that's nothing. That's just like a gift I can give you. Teaching a mom how to breastfeed. I've become really, really good at teaching patients how to get their babies latched on, which that's going to be my next certification. I'm going to get a lactation consultant certification because I actually love it. And when I was a newer nurse, I used to be so scared to help people learn how to breastfeed because it was like this foreign thing. But because I've been doing it for so long, I've become really, really good at teaching or educating people about different positions and techniques and how to get the baby to wake up and all those good things. So those are the things that I like about postpartum. So pros and cons, I probably already talked about what the pros and cons are between those two positions, where labor, it's more labor intensive. Postpartum is not as labor intensive. However, you are expected to do a lot of teaching. So that's like kind of the big difference between the two. How do you chart was another question. It's kind of hard for me to answer that question here on YouTube. I will give some charting pointers and techniques and things that I feel like work best for you as a nurse. So I like to chart in real time. So in my opinion, it's always best to chart in real time. And I realize that sometimes we are so busy that sometimes you just have to get into a room, write your notes down, and get out because you have other things to do. And I get that. However, whenever possible, I feel like it's best to chart at the bedside in real time, because when you do that, there is less chances of you, one, making an error in your charting, two, you're not going to forget. Oh, like for me, I always forget where somebody's IV is placed. And so if I don't chart it right, if I'm at the bedside, I can look at that patient and say, oh, her IV is in her right hand. So I know that. But if I don't write that information down because I'm quickly in and out of the room doing something, then I gotta be like, oh, let me try to remember where it was. Or, you can always look in the computer and see, and hopefully whoever initially charted it correctly. That's the other thing about that. But it's always best to chart in real time because, again, it's less chance of you making an error, and it actually saves you time. Like, that is part of time management as a nurse. And I work with a lot of new nurses, and time management is something that is essential for new nurses to learn, because if you learn this at the beginning, then you can carry that throughout your entire nursing career. Okay, it saves you time when you chart right in the room at the bedside, because when you go to sit down after you've seen your 4 or 5 patients, guess what? If you've already charted at the bedside, that's one less thing that you have to do for your shift. And I'm all about working smarter, not harder. So whenever possible, chart at the bedside. If you're not able to chart at the bedside, you want to make sure that you have, I carry a clipboard that has a sheet. Hold on, let me get it for you because I actually have. So yes, I am nerdy, honey. I am that nurse who walks around with a clipboard. Okay, I got this from Marshall. It was like $3.99. Anyway, I am really into things like nice clipboards, pretty paper. I'm that girl. okay? But I use my clipboard and I do carry it around with me while I'm at work. And I have a postpartum sheet. Now, some people like to fold their piece of paper, put it in their pocket. Let me tell you something. I'm OCD. I don't like folded and wrinkled paper. Don't ask me why. It's just one of those things. I've never been a nurse to walk around and fold my paper into fours so I can stick it in my pocket. If that works for you, do that. As a nurse, you gotta do what works for you. For me, see, now that I've wrinkled this piece of paper, I don't even want to use it no more. That's OCD. We'll talk about that another day. But anyway, I have this postpartum sheet where I have, excuse me. So I have this postpartum sheet where I have everything about my patient. And then I have these columns with times that I can keep up with, timed things that I need to work with my patient. So, and it is a front and a back. So I could use this sheet for 2 rooms. On average, I have 4 couplets as a postpartum nurse. I can use 2 of these sheets per shift, okay? So this is how I chart, because I have everything about my patient's history here, and then my baby's history here, and then labs, medications, and pees and poops for my baby. So that is how I stay organized so that I can chart on my patients. And it's also how I stay organized to be able to give reports to the day shift nurse when they come in. So I chart in real time. And you always chart factual information about your patient. And I think probably in terms of charting, those are my biggest tips. Chart in real time, chart factual information, and make sure that in the postpartum area that you're keeping up with your times, when your baby's fed, when they peed and pooped, times that you gave medication to mom, and I think that's about it. So I don't know if that question was more specific to how we chart as postpartum nurses or charting in general. So I hope I was able to answer that question. Next question, another good question. What types of jobs can student nurses work when they are in school full-time, but also have a full-time work schedule? So this is a tough one. So let me just give you the scenario. The young lady who asked that question mentioned that she's going to be starting clinical rotations, and she was told that once you start clinical rotations, it is difficult. It is difficult to maintain that full-time work schedule because the hours for clinical may conflict with the hours that you're currently working. And I'm going to be honest and tell you that does happen as you progress in your program of nursing. So it really all depends on your nursing program. I'm going to give you from my perspective. When I was in nursing school, I went to a traditional nursing school where I had to show up and go to class at various times of day. And the first semester of nursing school, the clinical rotations were only like a couple hours. But as I progressed in my nursing program, those clinical rotation hours went from being at clinical for maybe 3 to 4 hours when we started fundamentals to when we got into specialty areas like med surg, peds, OB, psych, all of those things, critical care. Those clinical rotations for me were 8 to 12 hour days. And so it became a challenge for me to work and complete my nursing program. I wasn't able, when I started my nursing program, I was working full time. By the time that I got to the point where we were going to those longer clinicals, I couldn't work full time anymore. I had to quit my full-time job, which put a huge financial hardship on my family at the time. I was a non-traditional student. I had a husband and 2 young children when I started nursing school. So it put a financial strain on my household. It put a strain on my marriage. Like, it was real in the field. But it was necessary for me to finish nursing school. Like, I had to make that sacrifice where I was not able to work full time. And so, you know, that is a choice that you have to make based on your household and your needs. Like, I'm not going to ever tell anybody what they should do pertaining to whether we got to eat or I got to finish nursing school. Like, it's a struggle. It is. For me, I know that I was not able to work full time. And so there are jobs that you can get to support you while you're in nursing school, but you have to look for those jobs, those opportunities. And one of the things that I would suggest is you can pick up a job as a nursing tech. If you can find a job like that where you live, if hospitals where you are offer those types of jobs, you can get a job as in like a residency program or a student nurse program. That's what I did when I was in probably my last year of nursing school. I worked on peds as a nursing tech, which I didn't like. I didn't stay there long. And they let me know I didn't want to work on peds when I finished school. Ultimately, I found a job as a student nurse there was a program that a hospital, I think they were collaborating with my school of nursing. And there was a program where they offered you 32 hours a month, not a week, a month, 32 hours a month. And you could work on a specialty unit, which I chose the OB unit. And that's how I got my first job as a new grad nurse as well. But yeah, I worked on that unit 32 hours a month. It was a struggle, if you can imagine. I think I was making like $12 an hour at 32 hours a month. That was like nothing. It was like pocket change to me. And that's what I had to do. So it really depends on your lifestyle. But I will tell you that the closer you get to completing your studies as a student, the closer you get to completing nursing school, it is challenging to work full time. So maybe you can find a job where you only work on weekends, but your clinical rotations are during the week. So the good thing about working as like a nursing tech is that you're going to work 12-hour shifts. So you could still work full-time hours, but you may be giving up your whole weekend, which, it's all a sacrifice. So you have to find out what works for you, figure out your budget, figure out your financial needs, and start to look for positions that you can work around your nursing schedule. It's really hard out here. And again, I don't ever want to tell anyone that they can't work full-time while they go to nursing school, but I will say it's hard. You have to be really dedicated to balancing work life, school life. Like, you really have to put in the time and the energy to make sure that you are studying and keeping up with your schoolwork while you're still working. So can you do it? You can, but it's going to be hard. And if nursing is what you want to do, you're going to sacrifice and make the changes that you need to make so that you can be successful in your program. Next question. Do you have difficulty finding postpartum travel nurse jobs? So as I told you guys in the beginning of this video, I'm now a travel nurse. I've been a travel nurse almost 2 years, and I will tell you is the best decision that I made in terms of working at the bedside. Like, I have no regrets about being a travel nurse. It really, really opened my eyes to why didn't I do this sooner? So have I found difficulty finding a job as a postpartum travel nurse? Absolutely not. The difference so one of the challenging things about postpartum travel nurse jobs is the compensation package is not as high as for labor and delivery nurses. And so because I can do both, I'm always trying to maximize my funds when I take a travel nurse assignment. Like, I want to have the best compensation package. So sometimes that weighs into whether or not I want to do a postpartum assignment or do I want to do a labor and delivery assignment. Right now I'm on a postpartum assignment, which is close to my home, but it's over the 50-mile radius that you need to make it a travel assignment. So it's like a win-win that I'm able to get my travel nurse stipend, my housing stipends and all that, but I don't have to pay for housing anywhere because I'm coming back home every day. So it's like a win-win. I've not had any trouble finding postpartum jobs. Different agencies have a bigger job pool than others. So sometimes, in my experience, I want to say like the bigger agencies have more availability, but it really depends on the agency, because some agencies can corner a market and they have like this region of the country on lockdown. So it really depends on the agency that you go with, what kinds of contracts they're going to offer. But I definitely have not had any trouble getting a postpartum assignment since I started. I actually started travel nursing locally on a postpartum unit, and I stayed there for 5 months. This postpartum unit that I'm on now, I've been there since May. When I complete my contract in November, which I'm so glad it's almost over, Maki Dada, oof. I will be there for 6 months. So I don't think there's any shortage of postpartum contracts. You just have to figure out where you want to go and what kind of pay package you're looking for. Those two might be the things that make or break you finding a postpartum travel assignment. And this video is long, oh my God. The last question on here is, what tips do you have for a new postpartum nurse? Wow, I really gotta think about that one, because it's just so much advice I could give a new postpartum nurse. What kinds of advice would I give a new postpartum nurse? I definitely would say, if you have not connected with doing a postpartum assessment and a newborn assessment, make sure that you go back to your nursing textbook before you start your job and brush up on that bubble HE assessment or bubble LE assessment. So make sure you are familiar with that. Make sure you're familiar with the newborn assessment. Be open to learning. This is a new skill set. If you are a new grad where you've never worked anywhere else, this is going to be all new stuff to you. You probably had a little snippet of this in nursing school, so you're going to give yourself time to learn everything. Normally, I believe that you probably get at least 8 to 12 weeks to learn that specialty area. So just be a sponge. Be open to learning everything. Remember that you're taking care of the whole patient. So oftentimes people just focus on the fundal assessment, and that is the fundus, or the top of the uterus. Of course, that is a big thing that we're assessing with our postpartum patients, but make sure you're assessing the whole patient. Make sure that you're assessing her emotional status. Make sure, you're addressing pain with your patient. Be ready to teach your patient a lot about how to care for herself post-delivery and how to care for her newborn. So oftentimes, when you go through your preceptorship, your preceptor is going to teach you a lot of stuff, but oftentimes there is a booklet on, I would say, most units that I've worked on where they talk about mommy baby care topics. Familiarize yourself with the topics in that booklet because you're going to be teaching your mom a lot of those things and it's going to become repetitious. So for any new nurse, I'm going to say give yourself time. Give yourself time to learn something new. So oftentimes, from my experience with new nurses and from my experience being a new nurse, we go into our new setting like, I want to know everything right now. But, give yourself time to learn. There's going to be a learning curve. You're not going to go in day one like, oh God, I know everything about the job. And if there are things that you don't know, you're going to have a preceptor who's going to be your resource person. Even if you don't go to your own preceptor, there are going to be other nurses on the unit that you can ask questions to. So don't feel like you have to be this know-it-all. Shameless plug for my business. Don't feel like you have to really know everything. You're going to learn. So give yourself some time to learn this new skill, okay? That would be my biggest piece of advice for any new nurse. But definitely in a maternal child setting, give yourself time to learn something new. Make sure that you familiarize yourself with the common medications that are given out in the postpartum period. And for the most part, they are Motrin, Tylenol, Colace, Senecot. Those are like your four biggest medications that you're going to give. And you should already know from nursing school the teaching that you're going to give somebody who's taking Motrin, Tylenol, Colace. Those things you should already know. I'm sure you learned that in nursing school. So familiarize yourself with the common medications that are given during the postpartum period. And if you are a new postpartum nurse and you're not familiar and you don't know which medications, you can put that in a Google search. I just gave you four, not five. I just gave you four. There's a couple other medications that we give, but those are the most common. Stethoscope. Make sure you have a stethoscope. Now, people always ask me, do you need a special stethoscope to listen to babies' heartbeats? I don't have a special stethoscope to listen to babies' heartbeats. This is my stethoscope. It's a stethoscope that I got off of Amazon. It is the ADScope, American Diagnostic Corporation scope. This is my stethoscope. This one right here. This is the one I use. Honey, I can hear mama heartbeats in here. I can hear baby heartbeats in here. Now, it does have a two-sided bell, but to be honest, I use this for everybody. Just like Frank's Red Hots, I put this on everybody. I use this for everybody. I don't have a special baby stethoscope. Now, when I was on assignment in Massachusetts, they had the teeny tiny little baby stethoscopes that we used to listen to neonatal heartbeats. If you were the neonatal assessment nurse, you had that little stethoscope. But I hear the same beats, the same lubs and dubs and clicks and all that stuff with that tiny little stethoscope. I hear the same thing with this one. So for me, I don't use a special stethoscope, but I don't know. Postpartum and NICU nurses, if you're watching this video, do you have special stethoscope? Do you guys prefer the smaller NICU? I don't even know what it's called, like what the technical name for it is, but do you guys use that NICU stethoscope to listen to your baby heart tones? I honestly can hear very well through this one, my little ADScope. That's the one I use. This is good advice for a postpartum nurse. Know that you're not going to break the baby, okay? Babies are very resilient. And of course, we want to handle them delicately, but just as I tell my parents all the time, you're not going to break the baby. So don't feel so nervous when you're handling the baby. You want to handle the baby gently, but you want to make sure that you're doing thorough assessments. And sometimes that means that you're going to be picking the baby up, turning the baby over, doing different things, palpating the belly and palpating the fontanelles and all those things. And sometimes if you have not done that, you're fearful of that. You want to be gentle, but you do have to thoroughly complete assessments. So this is going to take some skill and some practice. Like the first time I had to give a baby a bath, I was scared, like, oh my God. And I had already given my own kids baths, but this is somebody else's new baby. And it's like, wow. So know that you want to handle the baby gently, but you're not going to break the baby. So try to relax when it comes to handling the baby. But it does take some getting used to if it's not something that you do often. While we are talking about the stethoscope, babies cry. We all know that. You have to learn how to soothe the baby. So if you're trying to listen to your baby and the baby is crying, you have to learn kind of techniques to soothe the baby so that the baby can stop crying, so that you can hear everything that you need to hear, because you're going to be listening to lung sounds and you're also going to be listening to heartbeat. So that is a skill that you have to learn as a postpartum nurse. And again, you're going to give yourself some time when you are learning how to do this. But one of the things that I typically tell my students is, while you are listening to your baby's heartbeat, you are counting. And sometimes I tell my students, tap, 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 tap. I can't hear my own heartbeat. Okay. Tap, tap, tap. For every beat that you hear. And that's how you're going to learn how to count your beats. You can tap your finger. You can tap on the side of the crib sometimes, or you can tap your foot to count those baby heartbeats, because it's a skill. It's a skill that you have to learn. And again, it takes practice. Babies' hearts beat much faster than ours. So it's a skill that you have to learn and get comfortable with it. Again, the first time you do it, it's going to be like boom, da da boom, da da boom, da da boom, da da boom. And you'll be like, oh God, I can't hear it. You have to learn how to tune out the noise in the room and focus on the baby's heartbeat. So that's why I suggest that tapping of the fingers, tapping of your foot. Those things are normally helpful, because a lot of times while you're listening to baby, parents will be talking to you. So I'm always like, oh, 1 second, Mom, I'm listening to the baby. But that's a big skill that you have to learn with the newborn. And as a postpartum nurse, you need to know your abnormal and normal lab values when it comes to your mom as well as your baby. Oh, I know one of the biggest things that I can recommend to a postpartum nurse is having a good postpartum brain. So I have one here that I've designed that has all the information that you need in terms of history, lab values, medications, IV fluids, the baby information, history on the baby, and times in terms of keeping up with feeds, pees, and poops. This is not the one I designed, but I did design one that is similar. And if you want a copy of my postpartum brain sheet, all you have to do is click the link in my description section and I will email you a copy of the postpartum brain sheet, okay? Easy peasy, but definitely recommend that as a postpartum nurse, you have a functional brain sheet so that you don't have to remember all this information. Everything is here for you. And don't be scared to communicate with the physicians. So as the postpartum nurse, you're going to be communicating with an OB, and you may also have to communicate with peds. Don't be afraid to report things. If something doesn't seem right, you want to be able to communicate and report those to the OB provider or the neonatal provider. So I think those things would be the biggest things that I would recommend for a new postpartum nurse. If I think of anything else, I'll put it in the comment section. This video is long. It is 45 minutes long, but I've enjoyed this topic. I welcome questions because, again, this gives me the ability to really give you guys what you want, because that's what this platform is about. It is about educating you. It is about empowering you and hopefully entertaining you along the way on this journey to becoming a nurse or just learning about my journey as a nurse. So I thank you guys for watching. Please like, please share, and subscribe. And again, follow me on Instagram. That is where I spend time the most on social media. And here again at the Know It All Nurse is where you can find me. And I will see y'all on the next video. Peace out.